just again. And if you are connecting for the first time, I really appreciate every one of us. And for my returning subscriber, I really appreciate every one of us for always checking up. So I don't know how you spent your day. Good morning, good afternoon, good evening, depending on where you'll be connecting from. And today it's going to be the episode 2, season 1 of The Doctors Were Never Wrong, where we'll answer questions on things you may never understand. So this platform or this series is supposed to give us that opportunity, the platform to actually ask difficult questions, questions that people are actually afraid to ask, questions people wish they would have asked, questions that people never had the opportunity to ask while they were under the healthcare setting, while they were being attended to by healthcare personnel. So these are that very opportunity where you can ask those questions. So if you have any questions at all, please do let us know about the topic we are going to be discussing this night. And for every of the every of the episode of this particular series that we are going to be taking, please, if you have any question at all along the way, do well to drop them. If you watch the rebroadcast, also do well to drop your questions. If you check back later and then you have any question along the way, please do well to drop it. Without making further ado, let's go deep into today's discussion. And on today's discussion, we're going to be considering hypertension. Hypertension happens to be the topic of consideration. And if you have any question at all about hypertension, this is actually the right moment for you to drop those questions. So I would be taking each of those questions one after the other. So at this point, it will interest you to know that a lot of persons are actually undergoing or are actually suffering from hypertension without even knowing. And it will also interest you to know that hypertension falls among the category of illness called silent killers. What are actually silent killers? These are disease conditions that does not announce their arrival. This disease condition, they will not tell you they are there. You only wake up to find out that the symptoms actually things you are experiencing. That's why they are called silent killers. And before any help would be offered in most instances, you have actually lost the client. So that's why they are called silent killers, right? So we're going to be talking about one of it, which is hypertension. We have other forms of silent killers, of which diabetes is among one of them. So hypertension is another one which we are going to really deliberate on in today's discussion. That will take us to where I need to ask, what do you understand by that term hypertension? Let us know in the comment box. What is your own perception about that word hypertension? Do you have someone that is experiencing hypertension? Have you heard about what have you actually heard about hypertension? Have you heard about it before? What do you know about hypertension? Let us know in the comment box. What are the misconceptions that you have heard about hypertension? Let us know in the comment box. So many persons may have been wondering, will I continue living on medications? Is this how my life is going to be? Is this how I'm going to continue my life? Or does it have cure at all? Most of those questions will be attended to on this very live stream. All right. So do well as you connect to ask any question at all around this particular topic that we are going to be considering tonight. Now, that will take us to what we need to know about hypertension. Hypertension is commonly known as high blood pressure. It is one of the prevalent chronic healthcare condition. Hypertension is one of the most chronic prevalent healthcare condition, and it has been recognized worldwide as a silent killer, which I've already explained what silent killer simply means. Silent killer simply means those disease conditions that will not announce themselves. You only find out that you are already having a severe complication as a result of their presence, right? Of which I've mentioned an instance, we have diabetes mellitus, we have hypertension, and the rest. So they only announce most time themselves in the form of complication, but their onset, you may never know that you already had these kind of sicknesses within you. That's why most persons will recommend that from time to time you go for checkups, right? So for my persons or people in the local community, hypertension simply mean hypertension as a silent killer simply mean that condition wey no dey announce himself. You go just wake up one day find out say you don already dey get complications, you don already dey get the severe form of it. That's what we call silent killers, right? And it's important for us to know that due to the lack of obvious symptom of this condition is the reason why we call them silent killers. It significantly increase the risks of heart disease such as stroke, kidney failures and other life-threatening conditions. We are saying that hypertension fit make person get stroke. Hypertension fit make person get serious heart conditions wey involve wetin dey call left ventricular hypertrophy. E also get other condition called right ventricular hypertrophy. E fit lead to pulmonary hypertension. At the same time too, hypertension also fit lead to other kidney condition. E fit make your kidney get other disease condition. So those are the important things we need to really note about this condition called hypertension. E dey very important too for us to know that despite the dangers of hypertension, hypertension is both preventable and manageable. Despite the fact say hypertension dey very life-threatening, you fit still manage am, you fit still prevent am. E dey very possible. Thank you so much everyone for connecting. I can see all of us. If you're just connecting, please do well to like the live stream. I really appreciate our presence here. Do well to like the live stream. Please, if you're just connecting, do well to like it. And if this is your first time here, you can click that subscribe button below. Click that place you see subscribe and do well to subscribe so that when content like this drop, you'll be among the persons that will benefit from it. On this particular series, we're talking about difficult questions that most people are scared of asking. They wish they would have asked, or they don't even know how to ask it when it comes to their health care. So you can do well to drop any question at all around this particular series. But for this night, we're talking about hypertension, where we're going to be considering questions that some people are afraid of asking about hypertension. We're also going to be dropping questions we're going to be talking about questions that most people wish they would have asked. So those questions where you fear to ask, those ones where you wish say for ask, those ones where you always forget to ask, this is the opportunity for you to ask those questions about hypertension. Okay? Now, it's important for us to also know, I've already said that despite the fact wey be say hypertension fit kill people, e dey very dangerous and delicate, it is also worthy for us to note say it dey important for you to know say that hypertension you fit manage am and you fit prevent am. It's very necessary for us to note that it can be prevented, it can also be managed. At the same time, it's important for us to note that it is a well-equipped and knowledgeable person that will be able to take action when he sees the signs and symptoms. So that's why on this particular discussion tonight, I'm going to tell us the signs and symptoms that you should look out for. Those warning signs for you to know that I'm already having hypertension. So there are warning signs that when somebody have hypertension, the person will be able to know that I'm having this symptom is that of hypertension. So for this very discussion, we go tell us those warning signs, those things where if you see them, they happen, you're going to say, you don't like say my BP don high, my BP dey very high. Okay? So those are things we are going to be discussing this night. It's important for us to know that by way of definition, hypertension simply means a condition where we say the force of the blood pressure against the artery of the walls of our heart is continuously high. The force of the blood pressure for our heart, the force when our heart dey pump blood, e dey very high. Na im be hypertension. So hypertension is a condition where the force of the blood against the artery wall is consistently high. So The simple definition is that any blood pressure, when you measure your blood pressure and you see say if you dey less than 60 years, your blood pressure dey above 140/90, or if you dey above 60 years, your blood pressure dey above 160/100, e mean say you don get hypertension. If they continuously check am for at least over 3 different times, e still dey give you that same reading, e tell you say you don dey get wetin, hypertension. So whenever you check your blood pressure at least for not less than 3 times, you notice that if you dey less than 60 years, it is higher than 140/90, or if you are more than 60 years, is always more than 160/100. It tells you that you're already having what? Hypertension. Now that means that the systolic and the diastolic, which is the upper reading and the lower reading, it is higher than 140/90 for younger people, and then 160/100 for people above 60 and above. All right. Now, what are the causes of hypertension? What are the causes? Hypertension can be caused by a variety of things ranging from lifestyle, genetics, and other medical conditions, including medication. So plenty things fit cause hypertension, including the kind of lifestyle we get, the kind of medication we dey take, the kind of other disease condition wey we get too fit cause wetin? Hypertension. Alright? So we are saying that hypertension can result from what? Somebody that have other what? Disease condition, or the kind of lifestyle that we maintain. It can actually lead to what? Hypertension. The kind of medication we dey take, it can lead to what? Hypertension. And then when we talk about hypertension, e get 3 major things we suppose know, we suppose understand whenever we talk about hypertension. One of it is that changes in the cardiac output, which is the volume of blood that is sent out. This simply means that when the volume of blood that is sent out is actually much versus the artery now that the blood is going out through. If the artery is smaller than this amount of blood that is going out, it shows you that there is possibility that hypertension is on the way. Now, the next one is changes in the peripheral resistance. Anything at all wey fit block your blood vessel, your vein, your artery, it fit lead to hypertension. Anything that can block the arteries, anything that can block the blood vessel, it can lead to what? Hypertension. Thank you so much everyone for connecting. Do well to like the live stream if you are just connecting. If you just dey connect for the first time, abeg try subscribe, so that when con ten t like this drop, you go be among the first persons wey go benefit from am. Alright? So do well to like the live stream. Do well. Click that like button so that you can be able to like the live stream. Okay? That takes us to what? The next thing that we should know when we're talking about hypertension. Changes in the cardiac function, wey be the way your heart dey function. E go determine if you get hypertension. Alright? Now, that will take us directly to the next thing that we need to consider under the causes of what? Hypertension. Now, hypertension, as I don earlier tell us, hypertension can result as a result of other disease condition that the person have. It can come from other condition that the person have. It fit come from the family. So somebody wey im papa or im mother don get hypertension, somebody that your parents have already had hypertension, there is every possibility that you can also come down with what? Hypertension. So you can actually inherit hypertension. You fit inherit hypertension. Now, the kind of lifestyle, especially those people that work in the office 24/7, it is possible that you can come down with what? Hypertension. People that their work is very stressful, stress can lead to hypertension. If the kind of work wey you dey do, e dey very stressful, e dey very possible say you go get hypertension. The next thing is that certain medications such as contraceptive, certain medications such as contraceptive can lead to what? Hypertension, because of a particular hormone that is, that is released called corticosterol. That hormone fit lead to wetin? Hypertension. That family planning drug, certain family planning drug wey people dey take, e fit lead to wetin? Hypertension. Alright, that will take us to the next one, which is for lifestyle. For instance, people wey dey smoke, people wey dey take alcohol, those people that use alcohol, those that smoke, they can come down with what? Hypertension. People that consume high level of caffeine, they have the tendency to come down with what? Hypertension. If you too dey use things wey get caffeine, for instance, caffeine fall under the class of drug we call stimulants. So they fall under the class of drugs we call stimulants. So for instance, pepper, high pepperish consumption can lead to what? Hypertension, because it is what? A stimulant. Oh, my sister, thank you so much for having me here. Thank you so much. Thank you so much. Thank you so much. Good evening, my sister. How are you doing now? Thank you so much. All right, so we are saying that hypertension can result from different causes. The lifestyle that we have, those people that take, oh, happy to know, my sister. Sorry, I think this is weekend. I will create time. I have to create time so that I can visit you. It just remind me that I was supposed to visit you today. So I'll try to create time either this night by God's grace. How you doing now? I hope you are fine. Thank you everyone for connecting. If you are just connecting, please do well to like the live stream. If you are just connecting, do well to like the live stream. So we are saying that the kind of lifestyle, people wey dey smoke, they fit get hypertension, and we call that kind of hypertension substance induced hypertension. People wey dey eat too much of pepperish food, e dey possible say later on they fit come down with hypertension because of the presence of caffeine. Now, people wey dey take high caffeine things, those drinks wey contain high level of caffeine, dem get the tendency to come down with what? Hypertension. Then people wey be say dem born dem from family, your father, your mother, your papa, your uncle get hypertension, e dey possible say you fit get hypertension. People wey be say their family dem get people wey get diabetes, e dey possible too say dem fit come down with what? Hypertension. Other disease condition too fit lead to what? Hypertension. Yes, pepperish food, because it is actually it fall under stimulant. It can stimulate the release of certain hormones that will lead to hypertension. Exactly. So you have to moderate it, my sister. You have to moderate it. Most times it is later on in the life that you see the effect of most of these things. Yes. So the next one is people that use certain medication, which I have said, for instance, family planning. If you dey take family planning, some of those family planning, e dey go trigger a particular hormone wey we dey call corticosterol. That particular hormone fit lead to hypertension, because the hormone, wetin e dey do for the blood system, I will explain it better later. When the hormone goes, it will absorb back salt. Instead of the salt to go out as waste product, it will absorb them. Instead of the water too, for you to urinate the water, it will absorb the water. That is what this corticosteroid dey do. And so therefore, the presence of too much salt, people wey dey eat too much salt, wetin salt dey do, if you expose am to this thing, atmosphere, you go see say later e go dey soft. Salt absorbs water. It absorbs atmospheric water. So because of that, it will now act as block. It go dey block your blood vessel. E go block am. And at the same time, because it is absorbing water, the amount, the volume, it will increase the volume of your blood as against the vessel that is passing through. That is how it works. Now, the next one is what? People that have other medical conditions, which I've already said, diabetes, people wey get endocrine system wahala, and so on, they can have what? Hypertension. And then people that expose themselves to too much stress, you fit come down with what? Hypertension. That's why you need to create time to do what? To rest. No matter how your schedule look like, try to create time to rest. Then people wey be say dem dey obese, obesity can lead to what? Hypertension. That's why you need to work uh, on your body weight. You need to be doing exercise from time to time so that it will control that high degree of fatty, help you to cut down the high degree of fatty tissue. All right, because what fat does in the blood vessel, if fat go to your blood vessel, it will block it. Just try to carry that fat when you warm meat and put in straw. You see what happens to that straw? It blocks it, that things cannot move in freely. That is the same way it does in our blood vessel. It is the same thing. So the next one we need to know is people, okay, I've said certain medication, and said then pregnancy too fit lead to hypertension. We call that kind of hypertension pregnancy induced hypertension or pregnancy hormone induced hypertension. All right, and there is a name for it. Who can tell me the name in the comment box? Who knows the name for pregnancy induced hypertension? Who knows it? Let me see who is following me. Who knows the name of pregnancy induced hypertension? Let us know in the comment box. If you know the name for it, let us know in the comment box. There is a name for that condition. Okay, how many of us have heard that word called preeclampsia or eclampsia? It is actually pregnancy induced hypertension. All right, so preeclampsia, or we call it eclampsia. All right, that's the name for it. That will take us to the various types of hypertension. So as I've said earlier, just stay close. I will tell us some questions people are afraid to ask that connect to hypertension. Those ones that people wish they would have asked. Those ones that people used to forget to ask when they meet their doctors. Those ones that people are very scared. They don't know if they should ask it. Some people do not even know how to ask it. I'm going to tell us some of the questions. You can also drop your own questions, and we're also going to attend to them about hypertension. What are the types? Hypertension falls, we can categorize them into what? Primary hypertension. Another name for primary hypertension is idiopathic hypertension. Another name for it is essential hypertension. Then we now have the second type of hypertension called the secondary hypertension or non-idiopathic hypertension or non-essential hypertension. We now have the acute hypertension, we have the chronic hypertension. All right, so we have the different type. We have the under this primary hypertension, what it simply means, right? What is it? Okay, these are hypertension that you cannot directly tell the cause of, what particularly cause it. One thing is not enough to particularly for you to particularly or categorically say this is the cause of the hypertension. Whereas the secondary, you would know. The secondary means there is a direct cause, there is a known cause. So there are things that make someone come down with primary hypertension. All right, they include the age of the person. So people that are of later on in their life, they are prone to hypertension, which is the elderly persons. Those elderly people, people above 60, they have high rates of hypertension compared to the younger age. The race, black people, who can let us know why black people have high rates of hypertension than the white people? Let us know in the comment section. Why do the blacks have high degree of hypertension compared to the white? So the next one is the gender. Now the statistics tells us that men have the high prevalence of hypertension compared to women. Who can tell us the reason? So two questions. The first one is, why do black people have high rates of hypertension compared to the white? The second question is, why do we have high rates of hypertension in men compared to female? Why do we have it? Now the third factor that can cause primary hypertension is family history, where somebody in your family have already had the hypertension. So where somebody for the family don't already get hypertension, it is very possible for you to also have what? Primary hypertension. It can lead to primary hypertension. The next one is stress, which I don't explain already. Stress too fit lead to hypertension, primary hypertension. The next one is what? Obesity. Obesity can lead to what? Primary hypertension. That takes us to the next one called sedentary lifestyle. It can lead to what? Primary hypertension. The next one is hormonal or contraceptive use. Hormonal contraceptive use. People wey dey use family planning, this hormonal type of it can lead to what? Primary hypertension. That takes us to the next one called the diet that is high in sodium and fat. Those food wey contain high amount of salt, and then those fatty food dem fit lead to what? Primary hypertension. The next one is excessive caffeine consumption, which I don mention some things wey fall under the normal caffeine wey we sabi, and then high intake of salt as well as other caffeinated drinks. Now we will now have tobacco too. People wey dey take tobacco, those that uses tobacco, they have that possibility to come down with primary hypertension. Those that uses alcohol, those that uses cigarette, they have the high rate or marijuana to come down with what? Primary hypertension. That takes us to the secondary. Now the secondary, I said that secondary hypertension is that one that you know the cause. They can directly trace the cause of that hypertension. So we have things that can cause them. Fucomacytoma. This one is a result of the particular gland, the corticosteroid, the high and uncontrolled release in it of it. This hormone will lead to this condition. Now, Cushing syndrome, another one that can cause what? Cushing syndrome can lead to what? Secondary hypertension. The next one is thyroid or parathyroid or pituitary gland. Anything wey go affect your pituitary gland, affect your thyroid gland or parathyroid gland behind, it can lead to what? Secondary hypertension. The next one is what? Pregnancy induced hypertension. Pregnancy can lead to what? Secondary hypertension. It causes secondary hypertension. And then we have the contraction of the aorta, which this contraction of the aorta is when your right ventricle it don overwork, and then because of this overwork, the right ventricle will start failing, which is one of the parts in the chambers of what? Your heart. Now the next one is diabetes mellitus. Diabetes mellitus, if na im dey cause secondary hypertension. The next one is what? Head trauma leading to increased intracranial pressure, where be say the person get accident or e fall, e hit im head for ground, e can lead to what? Secondary hypertension. Alright? Now that will take us, having understood the difference between primary and secondary hypertension. Yeah, thank you so much, Jex. Thank you so much, Jex. So glad having you here. Thank you so much. How did you spend your day? And also let me know where you're connecting from. So I'm actually streaming from Africa, precisely the western part of Africa. So where are you connecting from? Let me know, please. Let me know where you're connecting from and how did you spend your day. So that will take us to the next one, which is, let's look at the prevalence of hypertension. Earlier on, I have told us that the men have high rates of having hypertension. I'm with my... Oh, that's good. Thank you so much. Thank you so much for having time to connect. Thank you so much. So I'm saying that men have high degree of chances to come down with hypertension compared to women. And I was asking earlier, why is it so? The next one is that the black people have high degree or high chances to come down with hypertension compared to the white people. And I asked, why do you think so? Now, over 1.28 billion people globally have hypertension according to WHO report in 2023. Over 1.28 billion people, according to WHO in 2023, are already having hypertension globally. Now, if that is the result, the research that was done in 2023, we are currently in 2025, That tells us how much it must have already uh, increased. All right. Now, fewer than 1 in 5 people with hypertension have it under control. So they are telling us that people, out of 5 people, if you carry 5 people now, if you have 5 people, out of the 5 people, only one person can actually control his hypertension. Only one person have really understood how to control his or her hypertension. That takes us, please, if you are just connecting, do what to like the live stream. Click that like button so that you like the live stream, all right? I'll really appreciate. Thank you so much, everyone, for still staying by. The next one is that prevalence of hypertension increases with age, meaning that as you advance in age, because your system is getting weaker, the way your heart functions, you have the possibility to come down with what? Hypertension. Thank you. I've seen another person have given us a thumbs up. Thank you so much. Now, and it is higher in low and middle income countries. They are telling us that the second wall, that's we have the first wall, the first, those people among the first wall, those people, they are telling us that the people that fall under the category of the second wall, those one have high degree, those second low income and middle income class people, they have high degree compared to the upper income class people. The next one we have to consider is what? We say that this is due to the limited access to healthcare and screening. So people that do not routinely check their blood pressure, they have high chances to come down with what? Hypertension. Please, if you are just connecting, do well to like the live stream. That will take us to how hypertension is formed. We call it the pathophysiology. How does it occur? How does hypertension occur? Let's discuss about it. Hypertension, we have already said, plenty things fit cause hypertension. A lot of things can give rise to what? Hypertension. So it can come from complex interaction that involve what? Increased cardiac output, which is the volume of blood pumped by the heart. So let's say, for instance, the person had head injury and then is bleeding. Your heart will want to pump blood sufficient enough to reach that part of the brain that is losing blood. So this, because the blood vessel does not expand in this case, the blood vessel will try to constrict, will try to reduce so that more blood will not be lost. In that instant, it can lead to what? The hypertension. So we say that what? Because there is increased cardiac output, which is the increased amount of blood volume, it will increase systemic vascular resistance, which will now narrow the blood vessel. When a lot of blood is lost and then a lot is pumped out of the heart, those blood vessels that is outside, they will start to do what? To reduce themselves so that too much blood will not be wasted. All right. Now, in this case, we're now saying that overactivity of the sympathetic nervous system. Where sympathetic nervous system, now that system, it is that system that helps you when your system is under attack, trying to reduce the negative effect of that attack on your body. All right. So when it is now overacting, we now say that it will lead to what? An abnormal renin, angiotensin, aldosterone system. Now, what we are saying that in your kidney, when it continues like that, your kidney now will now stimulate the release of renin. This renin will now convert angiotensin 1 to angiotensin 2, which will now further in the kidney, other part of your body, your blood vessel keep reducing in the size so that too much blood will not be what? Wasted. And then blood will be sent to the vital part of your system. While those ones that do not need too much blood, it will reduce the flow of blood towards those parts. That takes us to the next one, which is the endothelial dysfunction leading to poor vessel dilatation. And then finally, chronic inflammation and oxidative stress damaging vessel walls. Now, what we're saying is that as you continue, your aldosterone 2 will also secrete another, your cortex 2 in your kidney will secrete another hormone called aldosterone, which will help to take in salt instead of flushing out the salt in your system. At the same time, it will do what? It will also increase the amount of water that your body are absorbing instead of sending it out. And then things will happen which will take us to what we call signs and symptoms. What are those signs and symptoms? In your brain, when you're having, when if you want to know that this person, or if you are someone that they have told you have hypertension, if you want to know that the symptom is coming, the person will have frontal headache. So you go see say this part of your brain, e go dey pepper you, e go dey hurt you. You have that pain which is called what? Headache. So the headache is pepperish in nature. The frontal lobe, this frontal part, you'll be having headache that concentrates more here. You go get headache wey really concentrate this part, and the headache go dey very pepperish. That tells you that your blood pressure is what? Is high. The next one is because you are having that constant headache, you see the person will start having what? Confusion. You know, when headache is severe, you start acting confused. And in most instances, because of that, you cannot sleep. And in most, some people, they cannot even breathe well. Because at the lungs level too, if it continue, your lungs will start gathering excess water in it. And because of this excess water, you cannot breathe well. So some people will start having difficulty in breathing. And then for some people, for the brain, if those blood vessels they break off because of the high pressure that is in it, it can lead to what? Stroke in most persons. And then for some people, it can lead to epistaxis, where you start seeing blood coming out of their nose. And in some people, retinal damage, where their eyes can be damaged. And then for some people, you can now see their face, they have this flush on their face, facial flush. And then for some people, you see they have fainting spell. So if you don't experience this thing, if you have experienced this thing, it's telling you that your blood pressure is high, where you have this facial flush, that severe headache that is concentrated in the frontal part, and then you have confusion, you cannot sleep very well, you have apprehension for some people, and then for some people they'll feel very weak and tired. You cannot explain it even after you don't finish it. For some people, they say, I just finished it, but I'm feeling tired. It's telling you that what? Your blood pressure is what? High. The next one is what? Oliguria, which is at the level of the kidney. Because your kidney is absorbing water and salt, you will not be able to make enough urine. The level of urine that is made will reduce, which is the condition we call oliguria. And next one, impaired vision and speech, especially when stroke are setting, which is a result of those blood vessels in your brain. When they burst, it can lead to stroke. And then it will now damage other part of your system, which will now lead to what? Impaired speech. The person cannot talk well. You see, you have slow speech, then saliva can come out in some part. For some people, then one part of the hand, you now see you cannot use it very well. That is in the severe form, right? That tells you that what? Stroke have set in. That will take us to the next one. After we have already considered the what? The signs and symptoms. How do you diagnose hypertension? Now, how you diagnose hypertension? Let's start with these four things. First of all, if you are someone that is less than 60 years and they check your blood pressure, it must be not less than 3 different times. While checking it, your blood pressure is more than 140/90. It tells you that you have had hypertension. Now, if you are above 60 and then for 3 different times you have checked your blood pressure, it gives you 160/90. It tells you that you have what? Hypertension. All right? So it is not just once, but a minimum of what? 3 times, 3 different times, 3 different occasions. When you check, your blood pressure is above this range we have mentioned. It tells you that you have what? Hypertension. The next one I have to do what? When they do chest x-ray, when they do some of these radiographic tests, you will discover that you have left ventricular hypertrophy. Your left ventricle, which is one part of your heart, it don't increase in size. All right, because of too much work we they do. The next one, if they do ECG for that person, you'll notice that the waves is distorted. That wave for the ECG. It's not going well. It's not flowing well. And then the this thing blood, if they do blood test for you, they will notice an increase in urea, an increase in creatinine, an increase in nitrogen in your blood if they do blood tests for you. And then another way to diagnose is through urinalysis. All right, one, you should know that the volume of that urine will not be much. It tells you that what, there's a presence of what, hypertension. That will, so we're saying consistently elevated blood pressure reading taken on at least 3 times will tell you you have hypertension, which I've already explained. Then home blood pressure monitoring, 24 hours ambulatory BP monitoring. When you don't check am for house too, you still dey get high reading. It tells you blood, you have hypertension, right? Now supporting tests to identify, which I've already mentioned all these things. Let's just move to what? Management of what? Hypertension. Now, how do you manage hypertension? I have told us earlier, the fact that hypertension is life-threatening does not mean you cannot prevent it. It does not mean that you cannot manage it. You can actually manage hypertension, all right? You can effectively manage hypertension. So how do you now manage hypertension? We are saying that first of all, for lifestyle, you need to adjust the lifestyle. If you have a sedentary lifestyle, start doing exercise. If you consume alcohol, reduce the alcohol consumption. If it is coming from caffeine consumption, reduce the caffeine consumption. So if it is coming from too much pepper, you take it too much, reduce it. If you are someone that don't do exercise, adjust on it. If you are someone that is obese, try to work on your weight. If you are somebody that you know you already have the condition, go for checkup. Always go and get your medication. Take your medication on time. You have to be on medication, you take it on time. That's another way to manage and to prevent it. And then another way you can do that is what? You ensure that for your diet, you don't take food that is high in salt. You will not take too much salt. Try to reduce the intake of your salt. For people that have hypertension, try to reduce the intake of your salt. Even while you are still younger, try to reduce the intake of your salt and caffeines. The next one, for certain degree of this blood pressure, you may need admission. If your blood pressure dey very high, to help you, e mean say you go need what? Admission, so that at least you go get time to rest. Now, in the case where the person is admitted, it will need a quiet environment so that the person can be able to sleep and rest. Note that one of the symptoms is that the person cannot do what? He will not be able to do what? To sleep. So that's why sleep is one of the target recommendation. So the next one is that you monitor this medication for the possible side effect. Some of the medication have side effect. There are people who will tell you when they take amlodipine, they start having what? Excessive urination. Some people will tell you that when they take moderative, they start feeling this pounding and severe headache. So different people have different things they notice. Some people tell you they notice that their hand and their leg start increasing, start having fluid retention, which you call edema. And then the next one is that, as we have said, your weight, you need to reduce on it and so on. It's for you to discuss with what? Your healthcare provider. Whenever you meet your healthcare provider, discuss with them. Let them know the things you are noticing, the changes you are noticing. And then the next one is what? You need to have a BP apparatus. There's a stage that your blood pressure will reach. You don't need to always be going to the hospital. Especially some people, they even charge you for the check. So you need to have a BP apparatus of your own. You need to know how to take the blood pressure, where, so the cuff, where to put the cuff, and so on. You need to know how to do that. And then when you have taken medication, you see your medication is getting close to finish, ensure you go back and do what? Refill your medication. Now, Someone once asked me, let's now, this at this point, we want to go to the point where we talk about some of the questions that people are afraid to ask, some of the questions that people are scared to ask when it has to do with hypertension. So, without making further ado, what are those possible questions that people are scared of asking? All right. So let's start from. Sorry, I made a list of them, and I want to take us through. So you can actually drop your own question. Drop your own question, please. Drop your own question, please. If you have any question on this discussion we've discussed so far, any question you are scared of discussing with the doctor, sometimes I used to forget it and so on, drop it at this point. So 10 hard questions patients are scared of what? Asking. What are those 10 hard questions that people who have hypertension, they are scared of asking? 1. Will I die early because of my high blood pressure? Some people feel that they will pass on very early because of their hypertension. Is it true? The truth is that it is not necessarily true. Although hypertension is a silent killer, it's not necessarily true. So, if you manage your high blood pressure very well with lifestyle changes, as we have earlier advised, and then your medication, you take them very well, you take them when you are supposed to take them, you have a particular time that you take your medication, you don't just take your medications in a scattered form, and then you avoid all the risks that will lead towards serious complication, your blood pressure can always or will always stay within range if you practice these things. The next question that most people are what? Most people are scared to ask about hypertension has to do with, is it my fault I have high blood pressure? No, it is not your fault at all. It is not entirely your fault because high blood pressure can be inherited. But sometimes it might be as a result of the kind of work that you do. The kind of work. So you may not have option about the kind of work that you do. You can only have option by creating time to do what? To exercise. If it is a sedentary kind of lifestyle, the job is have to do with you always sitting down. You don't have time for exercising. So a lot of factors could play a role, such as what? Genetics, age, and other underlying health conditions. That's why it is not entirely your fault that you have hypertension. The next hard question most people are scared of asking is, can high blood pressure cause a stroke suddenly without warning? Can it cause? Yes. We mentioned a particular type of hypertension, the primary. We say that this one does not have a particular cause. So there's a possibility that you can suddenly have stroke before you know, because some of those symptoms in some people, they don't even announce themselves for so long before the complication set in. So it's possible for you to have stroke without having warning signs of what? Hypertension. The next one is taking medication forever the only solution for hypertension? No, it is not always so. Some people can reduce or even stop their medication. It's possible there are people, because of compliance, their medication will be stopped along the way, especially where it is substance-induced or pregnancy-induced hypertension. After the pregnancy, you can go back to your normal life. Your blood pressure after a while will return back to normal. And then if it is substance, if you stop the substance, your blood pressure will do what? Return to normal. The next one is, can high blood pressure affect my sex life? Yes, it can. High blood pressure can actually affect an individual's sex life. And what? We're saying that it can reduce blood flow. It can, which will now impact on what? Arousal. And some medication may cause sexual side effects. Speak with your doctor if this happens. Some people will tell you that because of the type of antihypertensive they are taking, they cannot perform very well on bed. So you need to discuss with your doctor in that instance where you are noticing is affecting your sexual life. All right. The next one that we need to ask, that most people are scared of asking, another question most people are scared of asking about hypertension is, will I need dialysis if my high blood pressure is high for too long? Yes, in most instances, it might lead to dialysis, especially if it have start damaging your kidney, where there's kidney complications. The next one is hypertension a form of heart disease? It is a major risk for heart disease. That is the answer to it. It is a major risk, but it is not a heart disease itself. Hypertension is not a heart disease itself, but it is a risk. Hypertension no be heart disease, but na risk to other heart disease. Now, however, if uncontrolled, it can directly lead to a heart problem. Now, can hypertension cause mental decline or dementia? So dem dey ask, some people dey scared to ask if hypertension fit cause dementia or reduction in their mental abilities. Yes, it can do so, especially when it have damaged organs or blood vessel in your brain. It can do so. So long-term uncontrolled blood pressure can impair brain circulation. At the same time, it can increase the risk for vascular dementia. All right. The next hard question most people are scared of asking about hypertension is that what happens if I skip my medication just once? What will happen is that you don't know if it is that day that complication will set in. All right. So missing one dose occasionally may not cause a crisis, but regularly skipping can lead to uncontrolled blood pressure. At the same time, serious complication can set in. The last but not the least question most people are scared of asking is, will I pass this on my children? Yes, hypertension can be genetically inherited. So genetics do play a role. Your children may have a high risk but can reduce it significantly with healthy habits. Now, 10 hard questions patients never had the time to ask. 10 hard questions most patients they don't have the time to ask. One, what is the ideal blood pressure for someone my age? Now, I've already mentioned that earlier, that if you are less than 60 years, your normal blood pressure is supposed to be 120/80 as the maximum. But if you now have something that is 140/90, it shows you that there is hypertension. If you are above 60, it shows you, if you are above 60 and you have blood pressure of the range of 160/100, it shows you that what? You have hypertension. The next one, how often should I check my blood pressure at home? Check your blood pressure at least once daily. If it's uncontrolled, if stable, a few times a week is fine. Always follow your doctor's advice, please. So if your blood pressure is stable, you can check it at least randomly from time to time. But if it is high, you need to check it frequently. The next question most people do not have opportunity to ask is, can stress really raise my blood pressure for long term? If you have a long term stress, yes, it can increase your what? Blood pressure. So chronic stress may contribute indirectly by promoting unhealthy habits like poor diet, smoking, or lack of exercise. Hence, it will lead to what? Increased blood pressure. The next one you need to know is, are herbal supplements safe for blood pressure? Some people they will tell you take supplements for blood pressure. So some people don't have the time to ask, can it actually play a role in managing blood pressure? Now, some of these herbal medication, it may help mildly, such as what? Garlic and hibiscus products. They might help in some extent to control your blood pressure. But many of these may not regulate your blood pressure. Many are unregulated and can interfere with medications. Some of these supplements, it can either lead to increase in the blood pressure or over reduction in the blood pressure. So you have to check with your doctor before you take any supplement for high blood pressure. The next question most people don't have the time to ask is, can I drink alcohol if I have hypertension? Please, just moderate it. Please, just moderate it, because it can actually lead to what? Hypertension. So one drink per day for women or two for men. But excessive drinking raises blood pressure and negates what? medication. The next question is, do high blood pressure always cause symptoms? No, I have answered this earlier. There are most instances it do not announce themselves. So it's often called silent killer because of that, because most time it will not announce its presence. So because it really causes symptoms until severe damage is done, so it may not always announce itself. The next one is, can high blood pressure affect my eyes? Yes, it can. So it can damage the blood vessel in your retina, potentially causing vision problems or blindness. Hyponeuropathy can also occur, and then in most instances, you will not be able to, you have blurred vision, you're not able to see very well. Now, how accurate are home blood pressure monitors? If used correctly and validated, they are generally reliable. Wrist monitors are less accurate than upper arm monitors. So the one that you use here, that BP apparatus that you use here, it is more reliable. And if you do it very well, your check is more reliable. The next one is, can I stop medication if my blood pressure goes back to normal? Can I stop medication if my blood pressure goes back to normal? Only under medical guidance, because most person may need to stay for almost the rest of your life on this medication. So please don't just stop on your own. Let the doctor guide you, maybe in reduction in the quantity, in the dosage, before you now move like that, before you start taking alternate days and so on. So we're saying that, are headaches a sign of high blood pressure? Usually not. Most people with high blood pressure don't have headaches unless it's extremely high, which is what? Hypertensive crisis. The next question, hard questions that most people wish they would have asked, they could have asked. One, why do I feel like a failure needing medication? I have to tell us today that you are not a failure. Many people need medication due to genetic or chronic stress. Taking charge of your health is a strength. The fact you are attending to your health is a strength. For the fact that you are staying long on medication does not necessarily mean that what? That you are a failure. Now, can I ever go off all medication permanently? Yes, you can do so. You can do so. But it has to do with what? Major lifestyle changes and suitable readings from your BP apparatus. And then, but this varies per person and must be done with a doctor's what? Approval. Next question is, how can I tell if my medication is even working? So you have to track your blood pressure regularly to know the one you had before you took it and the one you had after taking it. You have to compare and contrast. If it is consistently within the target range, it is what? Working. Now, is it safe to exercise with high blood pressure? Yes, in fact, it's recommended for you to exercise when you have high blood pressure. It's recommended. Moderate aerobic exercise helps lower blood pressure. Just avoid heavy lifting without clearance. So just the heavy ones is what you need to avoid. But light exercise can actually lead to what? Recovery. The next one is what? Will people judge me if I talk about my condition? Many people live with hypertension. That's what you need to know. So talking about it can encourage others and help you feel less isolated. The next question is, how do I explain this to my children or family? So keep it simple. I have a condition that means I need to take care of my heart and stay healthy with food, exercise and rest. So that is how you can discuss with what? Your children and your family. Can I fast or follow religious dietary rules with hypertension? Can I? Often yes, but always check with your healthcare provider, especially if there are medications that require full intake. Always talk with your clinician. How do I manage blood pressure when I am always anxious? So you may need cognitive behavioral therapy in that instance. And then mindfulness and some medication can help. Anxiety and hypertension often coexist in most person. Person fit get hypertension, fit get anxiety at the same time. Now, why does my blood pressure spike at the doctor's office? Some people will ask, why do my blood pressure tend to rise when I'm in the doctor office? This is called white coat hypertension. White coat hypertension. It's common Home monitoring helps get a truer picture of your normal blood pressure. So the next one is, why does my blood pressure spike? And okay, I've said that already. And the next one is what? What if I don't trust doctors easily? How do I get help? So how do you get help? Look for providers who take time to listen and explain. Consistently consider community healthcare workers, or what? Second option, if you don't have access to what? Healthcare provider. What are the hard questions they don't know how to ask? What are those hard questions? What exactly is happening inside my body when blood pressure is what? Is high. Your blood pressure pushes too hard against artery walls, damaging the vessels and organs over time, especially what? Especially the heart, the brain, and the kidney. The next one is, why do I need multiple medication for one problem? Different medications work in different ways, so combining them often improve the control with fewer side effects than a dose of what? Of one. Is it bad to feel fine even though my blood pressure is high? Yes. Feeling fine doesn't mean it is safe. Damage can be happening silently inside of you. Yes, it can be happening. The next one is, can I eat salt if I have hypertension? Just limit it. The recommended intake is under 1,500 microgram of sodium daily. Too much too much salt raises the blood pressure in most people. The next one is, how do I talk to my doctor if I don't understand medical terms? That's why we're having this discussion. So you can You can explain that in simpler terms. A good doctor will gladly, clearly understand you without what? Judgment. Do blood pressure meds damage any organ or what? Or do blood pressure damage any organ over time? Yes, it does. No, no, in fact, sorry. Do blood pressure meds damage any organ over time? No, please, it does not damage any organ. Oh. Please take note. In fact, they protect your heart, kidney, and brain from damage caused by high blood pressure. Now, can I travel safely with hypertension? Yes, you can. Bring your meds, monitor your blood pressure, and avoid high salt food. Inform your doctor if you are flying long distance. The next question is, can weight loss actually cure my high blood pressure? It can reduce or even more normalize your high blood pressure in some cases, even if 5 to 10 weight loss can have a high impact per week and so on per month, depending on the target you have. The next question is, what does hypertensive crisis actually mean? It is a severe blood pressure spike, usually 180 over 120, that can cause organ damage. It is a medical emergency and needs immediate attention. The last but not the least is 10 hard questions that should be asked, but you couldn't ask them. What are the long-term risks if I don't treat my hypertension? If you don't treat your hypertension on time, you can have stroke, you can have heart attack, you can have kidney failure, and you can have vision lost or poor vision, and you can even, in most people, would take their life. So how often should I have lab tests or check up with hypertension? How often should you do so? So typically every 3 to 6 months, but more frequently if your blood pressure is uncontrolled or you have other condition. Next one is what? In my current treatment, is my current treatment aligned with the latest hypertension guideline? Guidelines, what you need to know, guideline for treatment of hypertension, it does what? It changes over time. It actually changes over time. So ask your doctor if your treatment reflects the current best practices. Next but not the least is what? Okay, we still have other ones. The next one is, what lifestyle changes will reduce my need for meds the fastest? So weight loss, DASH, diet, reduce heart, regular exercise, and cutting, alcohol, smoking can all predispose to what? It can actually predispose, sorry, weight loss and so on, reduce salt, regular exercise, and cutting alcohol, smoking can all reduce blood pressure quickly and significantly. The next one is, are there any non-drug treatment I should explore? Yes, meditation. You can do meditation, you can do biofeedback, you can do exercise and dietary changes and have a proven result beside just what? Medication. Now, the next one is, could another condition be causing high blood pressure? Yes, we call them secondary hypertension. So a kidney disease can lead to hypertension, adrenal issues can lead to hypertension, and thyroid disease can cause secondary hypertension. At the same time, if you are under 40 or not responding to treatment, ask someone about it, preferably a doctor, so that they will see you. How can I know if my blood pressure monitor is accurate? Compare it at your doctor's office. Make sure it's a validated device. Check the British and American Hypertension Society list. So if you want to know if what you are taking at home is okay, you have to compare it whenever you go to see the doctor. The last, okay, I think, is that the last? Okay, second to last question most people are scared of asking is what? Is my blood pressure, blood pressure worse at certain times of the day and why? Yes, your blood pressure can change over these certain times of the day. So blood pressure naturally fluctuates. It's usually high in the morning and lowest at night. The pattern can change in some conditions. There are people that their own blood pressure is high at night and then it's low during the daytime. The last but not the least is, what's the difference between systolic and diastolic blood pressure and which is more important? Systolic is the top number, is the blood pressure when the heart beats, or is the blood pressure when your heart beats. Diastolic, which is the bottom number, is when it rests. So both matter. Both high systolic is more predictive of heart risks in order to what? In older adults. So all of them can actually lead to what? Hypertension. Now that would take us to what? A summary of this discussion. If you have any question about hypertension, please let me know, because we have touched a couple of questions that most people are scared of asking. Some people do not know how to ask it, while some people wish they would have asked it. Some people don't have the time. So please, if you have anyone who want to wrap up at this point, let us know in the comment box. Is there any question you have about hypertension? Any question? Any question at all? If you are just connecting, do well to like this live stream, and if you are here to subscribe, do well to click the subscribe button. At this point, we'll have to call it a day in the absence of any question. Thank you so much for connecting. I look forward to that moment where this particular live stream, this particular channel, becomes your most favorite click. But for now, stay safe, do enjoy your day and the rest of the night, depending on where you are connecting from. See you. Take care.